Now I have the full original transcript. Let me write the English version. Most men have no idea, but the penis ages just like every other part of the body. It loses blood flow, elasticity, and responsiveness, the same way your bones, muscles, and heart do over time. And when that's not recognized and not properly addressed, the consequences start showing up. Weaker erections, reduced sensitivity, decreased size, and a quiet erosion of confidence that most men never talk about. I'm Dr. Grace Holloway, and I've been practicing medicine for over 20 years. In that time, I've sat across from more men than I can count. Good men, strong men, who walked into my office believing their intimate life was simply over. That age had made the decision for them, and almost every single time they were wrong. Most sexual problems after 60 are not caused by age. They're caused by habits. Habits nobody ever taught you to avoid, and patterns that have quietly been working against you for years. The good news? With some straightforward adjustments, you can genuinely turn this around. No prescriptions required. No embarrassing conversations at the pharmacy. In this video, I'm going to walk you through the 6 most common mistakes that are undermining men's sexual health in their 60s and beyond. And more importantly, I'm going to show you how to fix them. And at the end, I'll share a simple natural recipe, backed by real science, that can help clear the blood vessels that supply this area and improve local circulation. Because for men over 60, blood flow is everything. If you're north of 60, this was made for you. Let's get into it. Before I get to mistake number 1, I want to share something that came from one of my patients, a man I'll call Robert, from outside of Nashville, Tennessee. He was 60 years old when he first came to see me. He'd been dealing with what looked like prostate adenoma for about a year and a half. He'd tried medications, he'd tried injections, nothing worked, and the pain just kept coming back. Eventually, he stopped trusting the medical system altogether. He started doing his own research, found some targeted pelvic floor exercises, and combined them with a full body strength routine. He stuck with it, consistently every day. A year later, he came back to my office. No more nighttime bathroom trips. No more erectile dysfunction. He stood up straighter. He looked me in the eye differently. He told me, "Doc, my health was always in my own hands. I just didn't know it yet." I've never forgotten that, and I want you to carry it with you through everything I'm about to share. Mistake number 1, believing your sex life ends at 60. This is the most common and honestly the most dangerous mistake I hear from older men. It usually starts with one rough patch, one failed erection, one period of distance from a partner, and suddenly there's this thought that creeps in. I guess that part of my life is over. Here's the problem. The moment that belief takes root, the body starts acting like it's true. The penis is living tissue, sensitive, highly vascular, dependent on blood flow and stimulation to stay healthy. Just like your heart, your muscles, your brain, it needs to be used to keep functioning. When a man convinces himself there's nothing left, and he stops touching himself, stops exploring, stops being curious about his own body, circulation drops, oxygen delivery falls off, sensitivity fades, tissues begin to stiffen, and sexual response weakens. Doctors call this disuse atrophy. And it has nothing to do with age. It has everything to do with neglect. Here's what I need you to understand. This process is stoppable. In many cases, it's reversible. And you don't need intercourse to do it. Intentional self-stimulation, pelvic floor exercises, which I'll explain in a moment, using a medical vacuum pump if necessary, or any method that improves blood flow and stimulation is enough to preserve both function and structure. I had a patient, 77 years old, from right here in the States, who reconnected with a woman he'd loved back in his 20s. They hadn't seen each other in decades. He was a widower. She was a widow. They spent time together, and he told me afterward, and with a kind of quiet disbelief in his voice, that what happened between them was unlike anything he'd experienced in his entire marriage. He said, "I never would have believed I was still capable of that." He was, because he'd never fully stopped taking care of himself. Sexuality is part of what sustains a man's self-worth, his presence, his vitality in the world. When that gets ignored, the damage isn't just physical. It hits your mood, your confidence, your sense of connection to other people. I've watched men start smiling again, standing taller, feeling wanted, just because they decided to start caring again. Not because they were trying to be young, but because they realized they still had value. And that value starts with refusing to abandon the parts of yourself you've been told no longer matter. Your body still responds. Your function can still be preserved. But only if you reject the lie that it's too late. Because it isn't. Mistake number 2, replacing real desire with pornography. In their later years, a lot of men find themselves alone. Some have lost a partner. Others face distance, routine, exhaustion. And in that silence, they look for pleasure wherever it's easiest to find, usually a screen. Porn seems harmless. One video here, one there. But what starts as a distraction slowly becomes a trap. A trap that suppresses real desire and disconnects the body from the real world. When the brain gets conditioned to intense, fast, solitary stimulation, it starts rejecting actual touch, real skin, real time, real presence. You might feel desire in the moment, but when intimacy actually happens, the body doesn't follow. The erection weakens, presence disappears, connection breaks down, and the man starts thinking the problem is physical. It's not. The problem is a brain that's been trained to respond to a kind of pleasure that doesn't exist in real life. Over time, this habit creates more distance. Shame creeps in, guilt, a quiet sense that you're less of a man than you used to be, and all of it invisible to everyone around you. But it can change. Cutting back on pornography isn't about punishment. It's about freedom. It's giving your brain the chance to reset, to feel again through imagination, through real touch, through intimacy that you build with another person rather than something imposed on you by a screen. Talk to someone, explore, be present. Without rush, without pressure, desire is still alive in you. It just needs to be reconnected to reality. Because real pleasure isn't what you watch alone in the dark. It's what you feel together. Mistake number 3, attempting sex before you're fully ready. Nobody talks about this one, but it's one of the most common and most damaging mistakes I see in my older patients. In the urgency to not miss the moment, or out of fear of disappointing a partner, many men initiate intimacy before the body is truly ready. And what seems like a small misstep can leave internal damage that doesn't show up on any test, until it's too late. The penis is made of delicate, highly vascular tissue. It needs to be fully erect to safely handle friction, movement, and pressure during intercourse. When that's not the case, microtears occur, tiny invisible injuries that over time become scar tissue. That scar tissue pulls on the surrounding tissue, causes curvature, and in many cases leads to a condition called Peyronie's disease. It's a deformity that can cause pain, make penetration difficult, and in advanced stages make a normal sex life essentially impossible. The heartbreaking part is that most men don't seek help until the damage is already done, and many never even connect it back to that hurried moment when they decided to push through before their body was ready. This is preventable. The rule is simple. Never start when you're not fully there. If you're using medication, give it time to work. Use lubrication. Extend the foreplay, touch, closeness, connection, until the erection is firm, stable, and comfortable. No pain. No doubt. That's not weakness. That's wisdom. That's respect for your own body. By protecting your tissue today, you're protecting your function tomorrow. And there's nothing more masculine than knowing how to take care of what's yours. Mistake number 4, ignoring intimate hygiene. This is a delicate subject, but it needs to be said plainly. A lot of older men still don't know how to properly care for their intimate hygiene, and they're paying for it in ways they don't always connect back to this. Here's what most people don't realize. The body changes with age, the skin gets thinner, the natural bacterial defenses weaken, and what used to be good enough on a quick rinse in the shower stops being effective. The result? Irritation, odor, recurring infections, and in some cases more serious conditions like balanitis. In extreme cases, there's even a documented link to higher cancer risk, and this is more common than anyone wants to admit. For men who are uncircumcised, the risk is even higher. Dead skin cells and discharge can accumulate under the foreskin, creating the ideal environment for bacteria to thrive. The solution is straightforward and takes less than 2 minutes. Wash with warm water and a mild, fragrance-free soap every single day. If you're uncircumcised, gently retract the foreskin and clean thoroughly underneath it. Rinse completely, don't leave soap residue. Pat dry with a clean towel. Don't leave the area damp. Don't wear tight underwear immediately after showering. Moisture is a breeding ground for infection. One more thing, after any sexual contact, hygiene needs to happen again. Fluids, sweat, lubricants, all of it can alter the skin's pH, cause irritation, and create conditions where harmful microbes thrive. This small habit, done consistently, can save you days or even weeks of discomfort, pain, and treatment. In your 60s and beyond, the smartest thing you can do is prevent problems before they start. And prevention starts in the shower. Mistake number 5, relying only on pills and ignoring everything else. Most men come to me with the same hope, a magic pill. They want something that'll bring back the desire, the strength, the confidence they remember. And I get it. I really do. But what almost nobody understands until it's too late is that no medication in the world can substitute for a healthy foundation. An erection is just a reflection of something much deeper, the state of your cardiovascular system. If blood isn't reaching that area with adequate force and consistency, the problem isn't desire. The problem is clogged arteries, inflamed vessels, and a heart that's been worn down by years of bad habits. Smoking, excessive drinking, poor sleep, chronic stress. These things erode the body from the inside out. And the first warning sign very often doesn't show up in your chest. It shows up down below. Here's something I tell every man who sits in my exam room. In many cases, erectile dysfunction is the first sign of a coming cardiac event. If you're only reaching for a pill, you're painting the walls of a house that's about to fall down. But here's the hopeful part. And I mean genuinely hopeful. The body responds to change faster than most people expect. Quitting smoking improves circulation within days. Replacing alcohol with water helps hormones rebalance. A daily walk, even just 20 or 30 minutes, strengthens blood vessels and genuinely lifts mood. When you make those changes, the body starts working with you instead of against you. Medication can be a support tool, but the real power is in what you do every single day. What you put on your plate, how much you sleep, how much you respect your own body. Don't hand over to a pill what only you can build. Mistake number 6, sleeping in tight clothing that's silently damaging your health. This one might sound trivial, but stay with me, because I've seen it cause real problems. You come home exhausted, fall into bed wearing the same underwear you had on all day, and don't give it a second thought. But that small habit can quietly work against one of the most sensitive parts of your body, especially after 60. During sleep, your body is doing serious repair work. While you're resting, circulation improves, oxygenation increases, and even the intimate area participates in this process through involuntary nighttime erections. These aren't just random, they're the body's way of keeping penile tissue oxygenated, elastic, and healthy. But if you're sleeping in tight underwear, restrictive waistbands, or synthetic fabrics that don't breathe, that natural process gets interrupted. Compression restricts full blood flow, irritates the skin, and prevents tissue from doing what it needs to do overnight. Over time, this causes micro damage, small injuries that accumulate silently. They leave scarring on the corpora cavernosa, the internal structures responsible for erections. That scarring pulls, creates curvature, causes pain, and can progress into Peyronie's disease, a condition that makes sex painful or impossible. And that's not all. Poor ventilation creates the perfect environment for fungal and bacterial growth in exactly the area where you need the most balance. The fix is simple. Sleep without underwear, or at minimum, wear loose, breathable cotton. Let your body do its nighttime work. Let the blood circulate. Let your body take care of itself the way it was designed to. It's a small change, but done every night consistently, it can be the difference between aging with vitality or aging with unnecessary limitations. Bonus, a natural recipe to support vascular health, the area where it matters most. After 60, one of the quietest enemies of intimate health is gradual vascular restriction. Over time, the veins and arteries that supply the penis become stiffer, narrower, more inflamed. And since erection is entirely dependent on blood flow, even minor narrowing affects firmness, sensitivity, and response. The good news is there are natural ways to fight back against this. And one of the simplest is this recipe I share with patients who want a non-pharmaceutical starting point. Write this down: 1 clove of raw garlic, well crushed. The juice of half a fresh lemon, squeezed right before you use it. 1 teaspoon of raw honey. A small piece of fresh ginger, about a teaspoon grated. And 100 milliliters of warm, not hot, water. Mix everything together in a glass and drink it first thing in the morning on an empty stomach. Make it a daily habit. Here's why each ingredient matters. Garlic is a natural vasodilator. It helps reduce blood pressure and decrease vascular inflammation. Lemon is loaded with antioxidants that fight arterial plaque buildup. Honey balances out the formula and provides steady natural energy. And ginger activates circulation, amplifying everything the other ingredients are already doing. Men who take this consistently often report improvements in erection quality and sensitivity over time. No side effects, no pharmacy visit, just the discipline of showing up for yourself every morning. This isn't magic, it's simple science applied to daily life. And for a lot of men, it becomes the first step toward reclaiming something they'd quietly given up on. We've covered a lot of ground today. And if you've made it this far, you already understand something that most men never get the chance to learn. Intimate health after 60 isn't a luxury. It isn't a vanity. It is your dignity. Every decision you make matters. Every habit you carry. Every choice you make about how you treat your own body. It adds up. It can be the difference between preserving what still supports you as a man or slowly losing it without ever understanding why. I've spent over 20 years watching men come to my office feeling like they'd already lost, and the ones who turned it around, the ones like Robert from Nashville, or the 77-year-old man who found connection again after decades, they all shared one thing. They refused to accept the story that it was over. You now have information that most men your age never get. The question is what you do with it. If this was useful to you, drop a comment below, tell me. I choose to take care of my intimate health. And if you know someone who needs to hear this, a friend, a brother, someone you care about, share this video with them. It might be the thing that changes their path. I'll see you in the next one. And